Let's talk about gastroptosis as we continue our discussion on face reading. Gastroptosis refers to a condition in which the lower edge of the stomach reaches the pelvic cavity when you are in the standing position, and the lowest point of the arc of the gastric minor curve drops below the intercrestal line of the crista iliac. This is the result of a long-term eating disorder or excessive fatigue, which leads to the sinking of middle chi and the failure to regulate the rise and fall of the stomach chi. Most patients with mild gastroptosis are asymptomatic. Those with evident gastroptosis often have symptoms such as insufficient gastrointestinal energy and indigestion. Gastroptosis occurs when the diaphragm is unable to support the stomach, leading to the hypofunction and relaxation of the liver and stomach and diaphragmatic gastric ligaments. As a result, there is a decrease in intra-abdominal pressure and the relaxation of the abdominal muscles. Other factors, such as body shape or physical constitution, render the stomach shape like a fish hook. Now let's go to face reading. Oval-shaped cloasma on the bridge of the nose are a sign of gastroptosis. Several black spots appearing on the cheekbone area and around the eyes also suggest gastroptosis. Here is a picture showing an oval-shaped cloasma on the bridge of the nose and a picture of several black spots appearing on the cheekbone area. For the therapeutic methods, the key to alleviating gastroptosis is to strengthen physical fitness, stick to a high nutrition diet, and exercise to strengthen the abdominal muscles, including walking, jogging, and tai chi. Eat small but more frequent meals. Chew slowly to break up your food more thoroughly and avoid raw and cold foods. For massage, we need the Zhongwan point or the Ren 12 acupuncture point with your finger for about 3 minutes, 3 times a day. This soothes the liver and stomach, stopping pain and vomiting. Stack the palm of your left hand on the back of the right hand and attach the base of your right palm to your upper abdomen. Massage your abdomen clockwise for 3 minutes, 3 times a day. This helps loosen your chest, regulate chi, and replenish the spleen and the stomach. Thank you for your attention.
Let's continue our discussion about interviewing on menstruation. The pain seen in blood stagnation is a stabbing pain that is sharper and more piercing than when there is chi stagnation. Furthermore, whilst chi stagnation, pain is felt in a larger area. Blood stagnation pain is localized to one spot, usually the same spot each time. The pain will be worse at the initiation of the menstrual bleeding, and the pain can sometimes be relieved by the discharge of clots. Menstrual pain caused by cold will resemble blood stagnation pain in some ways. The pain will be biting and fixed. The similarity to blood stagnation pain is that cold will stagnate in the movement of blood. Heat can cause stinging, searing, or burning pain. Dampness will cause a sensation of heaviness and dragging downwards as if the uterus is falling out of the body. Breast tension or pain in the premenstrual period is a sign of liver chi stagnation. This is because the liver channel has a branch that travels through the breast. Liver chi stagnation will also often mean that a woman is more irritable during this period. If she tends to be tearful and weepy in the premenstrual period, it is usually a manifestation of liver blood deficiency. Many women experience both of these types of mood swings. This just reflects that most women's liver chi stagnation arises from a condition of liver blood deficiency. Some women's menstrual bleeding has a tendency to stop and start, for example, starting with 2 days of bleeding, then a pause of a day or two, followed by 2 or 3 days of bleeding. This usually indicates that there is a stagnation of chi and or blood. Stagnant liver chi can invade the spleen and disrupt its functioning. This can manifest with symptoms such as alternating diarrhea and constipation, nausea, cravings for sweet, and edema on the premenstrual phase. Here in the menstrual cycle and bleeding, we see the observation and its significance. Late menarche, Jing deficiency, and blood deficiency stagnation is the significance. When there is difficulty conceiving, there is Jing deficiency and blood deficiency. Dampness and phlegm, Qi stagnation, heat, cold, kidney yin deficiency or kidney yang deficiency is its significance. If there are repeated miscarriages, then it may be due to kidney deficiency conditions, spleen Qi deficiency, or heat. Now, if the menstruation has a short cycle, there may be heat, both deficient and Qi, or spleen Qi deficiency and kidney Qi deficiency. If the bleeding has a long cycle, then there is blood deficiency, cold stagnation, could be blood stagnation or Qi stagnation. If it is an irregular cycle, this could mean liver Qi stagnation, spleen or kidney deficient conditions. If there is heavy menstrual bleeding, this can be deficient or Qi heat, spleen Qi deficiency, or blood stagnation. If there is scanty menstrual bleeding, this could mean blood deficiency, blood stagnation, dampness, or phlegm. If there's prolonged menstrual bleeding or spotting, this could mean heat, Qi stagnation, blood stagnation, or spleen Qi deficiency. If the menstrual bleeding that stops and starts, then this could mean Qi stagnation or blood stagnation. If there is thick menstrual blood, this could be Qi conditions. If it is thin menstrual blood, this could mean deficient conditions. If the blood is thin or is watery, then this could mean blood or Qi deficiency. If there are clots in the menstrual blood, this could mean stagnation of or fresh glistening clots suggests heat, and dark and dull clots suggest blood stagnation. If menstruation is murky or the blood is murky that looks as if it contains coffee grounds, this could mean stagnation due to cold. If it is bright red colored menstrual blood, this could mean heat. If it is black colored or very dark menstrual blood, this could mean blood stagnation. Then this could mean a deficient condition. If it is sticky menstrual blood, this could mean yin deficient or heat. If it is mucus in the menstrual blood, if there's mucus, then this could mean phlegm in the body. If there is a strong, rotten, or foul-smelling menstrual blood, then this could mean damp heat or fire. If there is pain before menstruation, this means Qi or blood stagnation. If there's pain during menstruation, this could mean blood heat or blood stagnation. If there is pain or discomfort after menstruation, this could mean blood deficiency. If there is strong cramping pain just before or during menstruation, this could mean stagnation conditions. If there is shooting, stabbing, or piercing menstrual pain, this could mean blood stagnation. If there is nipping or biting menstrual pain, this is cold. If there's heavy or dragging menstrual pain, this is dampness. If there's burning or searing menstrual pain, this is heat. If the bleeding occurs suddenly, there is blood heat. If it is delayed bleeding or prolonged bleeding, but without the bleeding being heavy, it is blood stagnation. If menstruation with a distended sensation, the menstrual bleeding takes a while getting started, then this is dampness or Qi or blood stagnation. If premenstrual, there's premenstrual breast tension, this is liver Qi stagnation. If there is irritability and aggressiveness in the premenstrual phase, then this means liver Qi stagnation. If there is tearful and sensitive, if a person is tearful and sensitive in the premenstrual phase, then this means liver blood deficiency. If there's alternating diarrhea and constipation, nausea, cravings for sweet, or edema in the premenstrual phase, this is liver qi invading the spleen. Thank you for your attention. Let's talk about acupuncture qi flow and points measurement. Acupuncture points are commonly located in the depressions or in the grooves of the body. To locate these points, we use proportional body parts as measurement tools. As seen in the diagram, the distance between the distal interphalangeal joint and proximal interphalangeal point of the middle finger is 1 chun. Here, in the illustration, we see the width of the interphalangeal joint of the thumb is also 1 chun. In this diagram, if you place the index fingers, middle fingers, ring finger, and little finger together in a plane, the width of the line across the middle finger PIP joints is 3 chun. This is also called 1 fu. Now looking at the head, as in the diagram, in the head, the distance from the anterior hairline to the middle of the eyebrows is 3 chun. The distance from the anterior hairline to the posterior hairline is 12 chun. The distance from the posterior hairline to the spinal process of the C7 is 3 chun. And the distance behind the ear between the two mastoid processes is 9 chun. In the anterior, chest and abdomen, between the sternal notch and the xiphoid process, the distance is 9 chun. The distance from the xiphoid process to the umbilicus is 8 chun. That from the umbilicus to the symphysis pubis is 5 chun, and between the two nipples is 8 chun. In the upper arm, the distance from the axial fossa to the transverse crease on the elbow is 9 chun, and from the transverse crease over the elbow to the wrist is 12 chun. In the lower extremities, the distance from the greater trochanter of the hip to the center of the popliteal fossa is 19 chun, and from the center of the popliteal fossa of the knee to the lateral malleolus is 16 chun. As seen here in this diagram, we see the measurements in the anterior chest and the abdomen, the upper arm, and the lower extremities, as discussed from the previous page. Thank you for your attention.
Let's discuss differential diagnosis, Western and Chinese medicine, insomnia. Number 1, symptoms associated with sleep disturbance, including letter A, difficulty initiating sleep, letter B, difficulty in maintaining sleep, letter C, early morning waking without further sleep. Insomnia is further classified as transient insomnia, insomnia that lasts for more than 3 weeks, very often associated to a stressful event. Next, cyclical insomnia, less common than transient insomnia and suggests an unstable balance between the sleep and wake drives. Instability may be due to maybe a temporary or lifelong. May occur with psychological changes such as premenstrual insomnia, psychological changes such as mania or depression. Number 4, chronic insomnia occurs most nights, lasts for a month or more, related to a hyperarousal state which persists during wakefulness as well as sleep. Could be due to a circadian rhythm disorder. Number 5, insomnia can be symptomatic of neurological or psychiatric disorders, especially depression, neurosis, cerebral arteriosclerosis, hyperthyroidism, stimulant drugs, alcohol, hepatitis, menopausal syndrome, anemia. Diagnostic questioning according to: first, difficulty going to sleep, very tired but inability to go under yin deficiency, startled, awake on falling asleep with anxiety and heat, heart and kidney yin deficiency, accompanied by restlessness and sweating, that is empty heat. Thinking too much, worrying, that is spleen chi, gallbladder deficiency, accompanied by being furious, that is liver fire, blazing, or there is pain, which is stagnation of chi, blood, or fluids. Number two, difficulty staying asleep, waking at 1 a.m. furious, gallbladder, liver fire, blazing, waking at 3 to or 5 a.m., food stagnation, yin blood deficiency, woken by excessive dreaming, restless, heat, anxiety, restless legs. That is empty, full, heat, fire, phlegm fire, or food stagnation. Waking cold, that is yang deficiency, nightmares, night terrors, that is kidney involvement, shock, fright, liver fire blazing, easily startled, gallbladder deficiency, night-long sleeplessness, extreme yin deficiency, waking with blocked nose, sinuses, that is phlegm dump. Number three, woken by need to urinate, inability to go back to sleep, that is yin deficiency. Easy to go back to sleep, yang deficiency. Number four, etiology, emotional stress, that is worry, anger, timid gallbladder. Consumption of coffee or other stimulants, eating late, vigorous exercise, disordered biorhythm, shift workers, pain, itching, difficulty breathing. Number five, soundful patterns. Vedic says there is stagnation of liver chi, liver fire blazing, heart fire blazing, phlegm heat harassing the heart and liver blood stasis, food stagnation in the stomach. For deficiency, there is spleen chi and heart blood deficiency, heart kidney yin deficiency, liver blood yin deficiency, gallbladder deficiency. Thank you for your attention.
Relationship between liver and gallbladder, kidney and urinary bladder. The liver is located on the right side of the lower jaw and the gallbladder is attached to the liver. They are linked by meridians and form an interior-exterior dyad. Bile originates in the liver and its storage and excretion depend upon the liver's conducting and facilitating functions. Unimpeded excretion of bile facilitates the expression of normal conducting and facilitating functions of the liver. Disruption of the conducting and facilitating activities of the liver can impede the excretion of bile, as in obstruction by gallstones also. Stagnation of gallbladder qi impairs the functional activity of liver qi as well as the free flow of qi and blood. Therefore, the liver and the gallbladder cannot be completely separated in physiology or pathology. In clinical practice, diseases of the liver and the gallbladder frequently appear together. For example, flaring of liver and gallbladder fire can give rise to the syndrome of subcostal pain, impatience, irascibility, a bitter taste, and a dry throat. Dampness heat in the liver and the gallbladder can give rise to the symptoms of jaundice, a bitter taste in the mouth, and flank pain. In addition, the liver governs deliberation and the gallbladder governs decisiveness. These two work closely together to maintain normal mental activity and judgment. The kidney and the bladder are both located in the lower jaw. They are linked by their meridians to form an interior-exterior dyad. The kidney is a Zhang organ that governs water metabolism. The bladder is a Fu organ that stores and excretes urine. The bladder's functions of opening and closing are dependent upon the transforming functions of kidney qi. If kidney qi is ample, the bladder's retentive power will be normal and it will open and close regularly to maintain normal urination. If kidney qi is deficient, so the qi transformation is abnormal, there may be dysuria, incontinence of urine, enuresis, and frequent urination. So here we could see the interior-exterior relationship of the liver and gallbladder and the kidney and the urinary bladder. Thank you very much for your attention.
Recording in progress.
Let's now proceed to diagnosis according to Zhang organ patterns with the pattern kidney qi not grasping long qi. The kidneys are responsible for grasping the qi that the lung sends down. If the kidney If kidney qi or kidney yang is weak, the kidneys will not be able to grasp and hold down the lung qi. This will disrupt the functioning of the lung and there will be dyspnea. Now let's go to its etiology. There may be a congenital weakness of the kidneys and lung. Working too hard physically, lifting and standing for long periods of time weaken the kidney qi. Too much sex, chronic illness, and old age are also possible factors. For the symptoms and signs, there will be shortness of breath, shallow superficial breathing, difficulty inhaling, spontaneous sweating, lumbar weakness, fatigue or soreness, sore or weak knees, dizziness, pale complexion, fatigue both mental and physical, disinclination to speak, puffy face or puffiness around the eyes, pale tongue, a deep and weak pulse, especially in the chair positions. The key symptoms, dyspnea, lumbar soreness, deep and weak pulse in the chair positions. Treatment principle, tonify and warm kidneys, strengthen the kidney's ability to grasp qi, regulate lung qi. The acupuncture points to choose from are kidney 3, kidney 4, kidney 7, kidney 25, REN 4, REN 6, REN 17, DO 4, lung 7, lung 9, bladder 13, and bladder 23. We use the tonify needle technique and moxa is also recommended. To further explain the choice of points, bladder 23, DO 4, REN 4, REN 6, kidney 3, and kidney 7 tonify kidney qi. Kidney 4 tonifies the kidney's ability to grasp lung qi. Kidney 25, REN 17, lung 7, lung 9, bladder 13 regulate lung qi. Men should avoid having too much ejaculation and women should avoid becoming pregnant. Both sexes should avoid lifting heavy objects and overworking. Light physical exercise is okay, but the patient should avoid training excessively and exhausting physical activity. Fresh air and breathing exercises will be beneficial. The patient should eat food that tonify the kidney yang. Kidney qi not grasping lung qi can be caused by spleen qi deficiency, spleen yang deficiency, lung qi deficiency, and kidney yang deficiency. Kidney not grasping lung qi can result in lung qi deficiency, phlegm, and stagnation of qi in the upper jaw. To summarize, kidneys failing to receive or to grasp qi has its etiology in hereditary weakness of the lungs and kidneys, long-standing chronic illness, excessive physical exercise, especially during puberty, like excessive lifting and standing. The underlying and accompanying pathology are kidney yang deficiency and lung qi deficiency. Possible presenting conditions, chronic cardiopulmonary failure. Signs and symptoms, shortness of breath on exertion, rapid weak breathing, difficulty inhaling, chronic cough, asthma, spontaneous sweating, cold limbs after sweating, swelling of the face, thin body, mental listlessness, clear urination during asthma attack, lower back ache, dizziness, and tinnitus. The pulse is deep, weak, and tight, and the tongue is pale. Treatment principle, promote the descending and diffusing of lung qi, warm and supplement kidney qi. For the acupuncture treatment, we use kidney 7 to supplement the kidney yang, stomach 36 to supplement blood and lung qi, do 4 to supplement kidney yang, kidney 25 to unbind the chest, do 12 to supplement lung qi, REN 4 to supplement kidney yang, kidney 3 to supplement kidney qi and essence, bladder 23 to supplement kidney qi, REN 6 to foster the original qi and fortify yang, REN 17 to descend rebellious lung qi, and bladder 13 to supplement lung qi. We needle with supplementation and moxa lung 7 with kidney 6 and stimulate the lungs to descend, stimulate the lungs descending and the kidneys receiving functions. Thank you for your attention.
Let's discuss mechanism of pathological change, imbalance of yin or yang deficiency. Deficiency of either yin or yang is principally manifested as loss of essential qi leads to deficiency. Loss of the essential qi actually encompasses the insufficiency of essence, qi, blood, and fluids, and at the same time decline in the physiological function of the Sangfu viscera, the meridians, and other organs. All these can be grouped in the two categories of yin and yang. Yang deficiency. In pathological state of yang qi deficiency, the functional capacity of the viscera declines. The responsiveness weakens and metabolism and heat production diminished. In general, these pathological changes reflect the inability of the weakened yang to restrain yin, thus giving rise to a disease of deficiency cold. This is known as yang deficiency, leading to cold in the exterior. A number of situations can give rise to the condition of yang deficiency. There may be inadequate prenatal endowment, postnatal malnutrition, internal injury from fatigue and exhaustion, or damage to yang qi by prolonged illness. In general, in qi deficiency, the most important factor is deficiency of kidney yang and spleen yang, especially the vital gate fire component of kidney yang. This is because kidney yang is the root of yang of the entire body. Because yang qi is impaired, the warming and transforming action of qi are weak, and blood and body fluid circulate sluggishly. Failure of yang to transform yin causes fluid retention. Failure of yang to restrain yin permits yin cold to prevail. Thus, in illness of yang deficiency, the symptoms include a pallid complexion, cold aversion with cold limbs, a pale tongue, and a slow pulse. Other symptoms include somnolence, polyuria of clear urine, diarrhea containing undigested food, and increased susceptibility to exposure. In severe cases, water metabolism is disturbed, and there may be fluid retention, oliguria, and edema. Next, yin deficiency. Yin deficiency, there is insufficiency of essence, blood, or fluids. At the same time, because of deficient yin cannot restrain yang, there is relative yang excess and false hyperactivity of the organ systems. This is known as yin deficiency leads to heat in the interior. In general, the characteristic pathological changes are insufficiency of yin fluids, reduced nourishment, inability to be calm, as well as symptoms of deficiency heat. Yin deficiency is mostly due to heat illness, injuring body fluids, or extreme passion transforming into fire and injuring yin, or chronic illness damaging yin fluids. In general, in yin fluid deficiency, the most important factor is deficiency of lung yin, liver yin, and kidney yin, especially kidney yin. This is because kidney yin is the source of yin of the entire body. Because reduced yin fluids cannot restrain yang qi, many pathological changes can occur, such as heat in the interior due to yin deficiency, blazing fire in yin deficiency, and overactivity of yang due to yin deficiency. Heat in the interior due to yin deficiency is marked by hotness in the 5 centers, very high fever, emaciation, night sweats, a dry mouth, and a red tongue, and a thread-like rapid and feeble pulse. Blazing fire in the yin deficiency and overactive yang in yin deficiency are marked by similar symptoms. These are high fever, night sweats, hotness in the 5 centers, malar flush, hemoptysis, emaciation, or insomnia, or seminal emission, or increase in sexual libido, dry mouth and throat, red and dry tongue, and a thread-like and rapid pulse, or lumbar and knee aches, dizziness, agitation, and irascibility. Thank you for your attention.
Enuresis and incontinence patterns, lung qi deficiency, and spleen qi deficiency. Clinical manifestations of lung qi deficiency frequent urge to urinate with inability to contain it, slight incontinence, often on coughing or sneezing, dribbling, weak voice, tiredness, slight sweating, shortness of breath. Tongue is pale, pulse is weak. Treatment principle, warm and tonify lung qi. Points, bladder 13, do 12, do 20, lung 7, ren 6, bladder 23, bladder 28, bladder 53. We use reinforcing method, moxa is applicable. Bladder 13 and do 12 tonify lung qi. Direct moxa on these points is particularly effective to tonify qi and yang. It is especially useful in this condition to use fire or moxa to contain water. Do 20 is used with moxa to raise qi and therefore contain urine. Lung 7 is the best point on the lung channel to affect the water passages. Ren 6 tonifies qi in general and specifically qi in the lower abdomen. Bladder 23 with moxa tonifies kidney yang and reduces urination. Bladder 28 and bladder 53 strengthen the bladder function. Now let's talk about spleen qi deficiency, clinical manifestations, slight incontinence, urgency, frequent desire to urinate and inability to contain it, loose stools, tiredness, poor appetite. Tongue is pale, pulse is weak. Treatment principle, tonify and raise the spleen qi. Points, bladder 20, stomach 36, ren 12, do 20, ren 6, bladder 23, bladder 28, bladder 53. We use reinforcing method, moxa is applicable. Bladder 20, stomach 36, and ren 12, tonify spleen qi. Do 20, ren 6, bladder 23, bladder 28, and bladder 53 have been explained. Thank you for your attention.